My name is Melissa Daluvoy, and I'm a specialist in cornea, ocular surface disease, and refractive surgery. My area of specialty in our department is to treat people with bad surface disease. So I do what's called a prosthetic cornea surgery and ocular reconstruction. So my practice is filled with patients from simple dry eye to very complex surface disease. My style of treating patients is just treat them like you know them, like they're your friends or family, or how you would want your friends and family to be treated. I think most of my patients will say I probably talk a lot, explain a lot, draw pictures. I want them to fully understand what they're committing to and what we're doing, and let them understand. I give them my advice and my suggestions, but I also give them enough information where they can make their own decision. I grew up in a family, I had no doctors in my family, and I originally went to be a physical therapist, and I worked a lot in hospitals and read charts, and I just found that I was more intrigued by the medicine aspect of things and thought, well, I could do that. So I went to medical school, and we rotate through all divisions of medicine, and I really liked that I could do surgery, treat children, treat adults, treat medical problems, all related to the eye. It sort of brought everything together. And we get to shoot lasers, which is fun. And so it just had everything I liked about medicine and about people all rolled into one specialty.